The member for Braddon.
Thanks, Mr Speaker. My question is to the Minister for Health. Will the Minister inform the House how the Morrison Government is supporting and protecting families, including those in my electorate of Braddon, through providing support for drug and alcohol services?
The Minister for Health.
Thanks very much, Mr Speaker. And I want to thank the member for Braddon, who has been, along with many members in this House on all sides, a great advocate for drug and alcohol services. We know that the challenge for families and people of all ages can be catastrophic. It can be opioids, it can be amphetamines, it can be alcohol, it can be any number of different substances which can cause catastrophic physical outcomes and, of course, tragic mental health outcomes. And frequently and tragically, these substance abuse cases are associated not just with economic disadvantage and impact, but also with suicidality and, in too many cases, suicide or overdose. I'm delighted that we were able to assist City Mission in his electorate with $6.3 million for drug and alcohol support. This will work throughout the northwest, but in particular with 10 beds. It's part of an initiative that is reaching right around Australia, over $780 million that is going into this work. We are also able to support a project which has very strong bipartisan support in this chamber, the Glen Women's Centre for Indigenous Women. It's in the electorate of Dobell. It has the support of the member for Dobell. It had the very strong advocacy of the member for Robertson, but it also had the support of the member for Barton, and I thank her for her advice. And this, of course, followed circumstances which were deeply powerful and important to her. So these are projects across the country, across electorates, across all political divides. We've been able to do work in the electorate of Gilmore with the Triple Care Farm, and this project, this proposal, has had the support of all sides, and under the Community Health and Hospitals program, it will allow people who are not just young, but people of all ages to receive support, rehabilitation, recovery from drug and alcohol challenges. With the member for Dawson, I visited Auscare in Mackay, and whilst we were there, we met people who were on the road to recovery. And perhaps of all of the different facilities I have met, the testimonials given on the personal care and the importance of residential rehabilitation and the way in which we have subsequently been able to support Auscare were perhaps the most arresting I have received. The stories of people who believed they had had no hope until they were given this residential care and residential support really struck a profound chord. It helped set up this national program, and I want to thank all of those workers, many of whom are volunteers, many of whom work for a modest amount, and to say that we are with them and with the families in their work to support Australians who have suffered from drug and alcohol. And I want to thank members on both sides of this House for their support in advancing these programs.